I'm glad to see the numbers going down, but we're still having patients coming in that have COVID. So there's kind of a break in education there about what that means, really. Just because the numbers are going down doesn't mean that we need to be lax right now or not adhering to what the guidelines are. So that's kind of, it's a frustrating, I find this wave has been a frustrating wave for us. At first, COVID was feared. It was feared for us in healthcare, but also for community. Now it's the fears kind of pushed aside, and as the public is getting more comfortable, I find the staff are getting more frustrated because the fear's gone, but COVID is still here, and I think we still need to have that. When someone comes in COVID positive at Picton, we have a specific room that is negative air pressure. So we need to kind of put the patient in where they are safest, keeping the rest of the department safe and us safe. And then we also need to be gearing up to go in and prepare. Basically, we designate a nurse to be in that room, and that nurse will be in that room with that patient for the basically entirety that they'll be with us. There's a fear, I think, because patients don't realize what that looks like. They don't realize that we're putting on our full protective equipment, we're putting on our respirators, and not on top of that. So it's hard for patients right now because they're not getting to see us. We're used to, humans are used to having this contact. And when they can't see our faces, and now with the respirators, you can barely hear us. Like it's been a challenge because even when there's a risk that we don't know if the patient is positive or not, we have to treat them as if they are. So if we're doing intubation, which is kind of a high stress situation for us anyways at a baseline, I would say that's one of the most demanding things to do in the emergency. We as a team, even to communicate is a bit of a difficulty because we have to almost be screaming to each other so that we can hear what the orders are. And for the patients, I think seeing us the way we are, I think that's the thing. They're scared because they don't know what is next, and kind of we don't know either. While they're with us in Picton, there's kind of a fine line. If they're going to be, if we can intervene and we can get treatment done to them, then they can. The goal for that is to be able to get them back home. If we can't get them to a point where they would be stable at home and need to be admitted to the hospital, then we at Picton don't have the ability to keep them at our facility. They have to get transferred to Belleville or any other critical care area that could take them. So that's also scary for them because they don't know. They're kind of crossing their fingers that it's something that we can treat them and get them home. And if not, then that means they're leaving Picton and they're going to another outside area. So they're scared.
So in this, all of this creates so many extra levels of complexity for you as a healthcare provider, and also to the patients who are experiencing this terrible disease. But what do you hold on to? What gets you through this?
Really, the staff, like the community that we are, how we work together has just been so impressive. So we hold each other up. And so I think I'm looking forward to a time where we're not having to hold each other up anymore, because it's been a long haul for us to support everyone else, but also to support ourselves. So I'm really looking forward to when we no longer have to be kind of holding everyone up. And that's the community is safer, and that we're safer, and that when we go home at night, we're not worried that we're bringing it home to our families, and that too. So it's just, I think that really is, if I could think of something to look forward to, it's looking forward to letting go and just being able to kind of take a breath and know that it's okay, and that, we've done what we needed to at work, and it's staying at work, and we're not having to worry about ourselves, about our community, about our families, and that we're in a safe place again. And that fear is no longer there, and that anger is no longer there. I think we've got a ways to go still, but that would really be the main thing, is to just take a breath is probably what I'm most looking forward to.
And then finally, what is your message to the community to help us to get to that point?
Thank you, Catherine. So yeah, I think my message would be to continue to follow the guidelines. That is our main defense right now, is to make sure that we are adhering to the guidelines and get that vaccine. I think the vaccine is the next thing, that a combination of the adhering to the guidelines and getting the vaccine will just get us to that point, like you said, to get us to the point that maybe we can take that breath. And I think those are the main thing. And then just support each other. Again, I think that we don't even realize how powerful that has been. So I adhere to the guidelines, get the vaccine, and continue the support.